problem.
Okay, we will record this transmagnetic stimulation. Yeah. Here is the.
I just need to close the door, please.
Okay. You will have 2 minutes. Just read the invitation and write down the questions which are going to be expected from you.
Okay.
This will to understand the dialogue and what will happen in the station.
Should I start reading it?
Yeah, you can start reading.
Okay.
You can have 2-3 minutes. Still, the cans did not come, so you have time. Okay, ready?
Yes.
Okay. Stop sharing. I'll set the timer. Let's say that my name is Michael. Okay?
Michael?
Yes.
Okay, that's fine.
One, two, three, go.
Hello, Mr. Michael. I am Dr. Shah, one of the psychiatrists from the mental health team. Nice to meet you, Mr. Michael.
Hello, Mr. Shah.
Okay. Mr. Michael, I have received some information regarding your depression, that you have been suffering from depression, and you have tried medications and some other treatment which is called ECT in the past. Is that correct?
Yeah, so they recommended for me something called RTMS. I don't know exactly what does it stand for. I had before ECT, it didn't work well. Sometime it worked. I would like to know more about this RTMS.
Okay. So thank you for sharing your concerns with myself. And Regarding the RTMS, it is abbreviated from repetitive transcranial magnetic stimulation. So it is a medical procedure and it is recommended for the treatment of depression in conditions where the medications and other therapies doesn't work well. And in this condition, like in this treatment procedure, a magnetic coil is placed on the head, a part of the head, and then it is turned off and on repetitively. And through that, the underlying brain cells are activated. Does it make sense to you?
Yes.
Okay. So, like, it has been well researched for the treatment of depression, as I told you.
Okay, so I'm just wondering, how does it work, doctor?
Okay. So, as I told you that this is a procedure where the magnetic coils are placed on the head, and then those magnetic coils, they are turned off and turned on repeatedly.
Yes.
So through that procedure, the current in the brain cells that are underneath the magnetic coils, they get activated. And when they are quickly activated, these coils turn off and on quickly. So in that case, it increases the activity of the brain cells. But when they are slowly turned off and turned on, so it reduces the activity. So in depression, it usually the brain activity in some people decreases, so it increases that activity of the brain and it make improvement in the mood and other symptoms of the depression. Does it make sense to you?
Yes, okay. So I'm just wondering, so what would happen in the session?
Okay. So in the sessions will start like there will be sessions which involve like starts like daily sessions will be there from 3 weeks to 6 weeks. Daily sessions, it will depend on the response that you will make, and we will monitor the response in your symptoms. And each session usually like lasts from 3 minutes to 30 minutes. Again, it depends on the speed of the procedure that we usually like keep on. Does that make sense?
I see.
Okay.
So any situation which I cannot take this RTMS for?
Okay. So there is no absolute contraindications with this treatment, but some of the conditions, like if you have had the epilepsy in yourself, fits, or there is a family history of fits, or like there are some cardiac pacemakers there, or some electrical devices in your body. Sometimes some devices are there for the hearing implants. So in those cases, we usually, because the electrical activity can affect the activity of those devices, so in those cases we try to like be more cautious if it is needed.
Okay.
Yeah.
So and why do you recommend this RTMS for me, doctor?
Okay, so thank you for asking this question. This RTMS is because I have read on the notes and you said that the medications didn't work well for yourself. And the ECT procedure, that was like a bit effective, but there were some concern regarding the anesthesia afterwards, effects of the anesthesia. Is that correct?
Yes.
Okay. So the beauty and the good thing with this treatment is this doesn't involve like the administration of anesthesia. So that is the good thing, yeah. And like this is well evidence for the treatment of depression. So that's why
I see.
I'm recommending
And
that.
what is the difference between it and the ECT?
So one difference is we talked about is this, like the administration of anesthesia. The other, like this treatment can be given to you on daily basis, on outdoor basis. Like you can come on daily basis, you can receive the treatment, and there will be no The other one is like there are no evidence-based like more side effects regarding the memory problems, which is main concern with the ECT sometimes people have.
Yeah, excellent.
Yeah.
So,
Yeah.
and how long does it take to feel improvement?
So it depends, but like we can't say anything for sure, but it depends on the monitoring and the response of the person. Usually it usually like on average it can take 20-25 sessions to see the improvement in the condition. Yeah.
I see. Can I drive to and from the session?
Is there is no like anesthesia involved in this procedure, so there is like no absolute contraindication on that, but it depends if you feel something like sometimes dizziness and sort of things, so we will see and we will go from there. Yeah.
So, well, any side effects for these procedures?
Yeah, so there are some side effects, no major side effects. Sometimes you may have like a slight headache, and sometimes if it is near to the jaw muscle, so it can have a tension, twitching of the face as well. So these are usually like temporary sort of side effects, which are not major of a concerns.
Time. How do you feel about what you did? Very good, very comfortable. I like your vibe. Everything is good. This is one of the explanation stations, and usually the explanation stations are straightforward, they are easy, they depend on the accurate information which you're going to give to your patient, and at the same time, your attitude and your assertiveness and influence and impression while you are selling your drug or selling your procedure. So don't be timid, don't be shaken or not very confident while you are talking about any medication or any treatment you are going to give to your patient, because you are supposed to make him feel confident that what you are going to give him is going to help him. As I always say, in every station, you must expect that there is a big and there is a considerable load of assessment of your communication skills, even in the simple explanation station. So let's see, according to the to my notes. Well, most of, but I cannot. I have no comments regarding the information. You gave all of the information the right way. Okay, so let's see how we can start this station. I would have preferred just to have a bit conversation about his depression. How are you doing now? How is your mood? It doesn't make any big difference because you were very he had a collaborative approach, okay? But in case if you want to start with a collaborative approach, you want to make sure that you understand where the patient is coming from, what is his mood and his appetite and so on, and give him some promising way of talking that there are many ways by which you can help him with, like changing the medications, talking therapy, ECT and RTMS, but you have gathered that he wants to talk about the RTMS. And he will say yes, and just give him, you must put this in your communication skill, the collaborative approach and selling your drug. You must make him feel that what you are going to offer him is going to help him. So RTMS is a very safe procedure. Indeed, it is helped many patients to control the symptoms of the depression. At least 30% of the patients achieved full recovery within 6 weeks, and the rest find great improvement in their symptoms. And this is according to the NHS sources. So in any explanation station, try to have a collaborative approach and try to sell your drug. This is part of your communication skills. Okay, now to the questions which are all under the heading of explanation. How does it work? Is simply the coils are going to be put on his head, and you can try to animate what will happen, okay, by putting the coils on the head, okay, in the forefront of the brain, and usually on the left side, which stimulate the part of the brain by magnetic energy. This stimulation makes the nerve cells active, which improves the mood. The RTMS stimulates the brain and causes neuroplasticity This is the brain ability to mend and build connection between nerve cells. Okay, so if you are going to talk or say any medical jargon, try to explain it immediately. Otherwise, you will consider to be using medical jargon. So here, neuroplasticity is a very important term. Okay, and stimulation of the left part of the brain by this type of activity will help to improve the mood. Okay, what happens in the session? In this session, the patient will sit comfortably on a chair, no anesthesia is needed. The doctor will place a paddle on a particular part of the brain, and magnetic impulse will be generated to stimulate the brain. You will be asked to remove any metal or jewelry, including the earrings, necklace, etc. And you will be seated on a chair during the first session. Several measurements are made to ensure that the magnetic coil is correctly placed. So we don't just place and give the stimulus. There must be some measurements to make sure that the place of the coil is suitable for this patient. You can have screenshots, please, if you don't have this stage, if you don't have these notes. Okay.
Yeah. Thank you. Thank you, sir.
And also very important to mention the earplugs. They give them earplugs. Okay. This is something we have missed. Show the examiner that you understand the procedure. This means that you know we know exactly because earplugs means that you have been there. During me, as the stimulator can be noisy, the magnetic impulse produces a clicking sound, and you'll feel a tapping sensation on the scalp. Okay, now who can't be given the RTMS? Because of the high magnetic field, some patients are unable to receive the RTMS. Okay, like those who have non-removable matter or in or near the head, except for braces or dental fillings. Therefore, people who have any of the followings should not receive the RTMS. Okay, like aneurysm, clips or coils, stents in the neck or the brain, deep brain stimulators, electrodes to monitor brain activity, metallic implants in your ears or eyes, facial tattoos, very important. Many tattoos now include metallic components. You might think that this is something which is trivial, but believe me, this is very important. Tattoo is very common now. Many of these materials used in the tattoo can contain metallic parts, and it can be catastrophic if you use with them the TRTMS. Okay, so you can have this the screenshot, and you can understand. Why do you recommend? As I said, bearing in mind the promising response and the history of improvement on ECT, most probably those who have improved on the ECT usually will have improvement on the RTMS. What is the difference between them? So in the ECT, there must be a fit, while in the RTMS, you don't need a fit. Okay, we are stimulating particular parts of the brain without the induction of a fit, while in the ECT there must be a fit which can be detected by the brain EEG. How long does it take to feel improvement? Usually 4 to 6 weeks, or between 20 to 30 sessions. You answered that correctly. Can I drive to and from the sessions? Yes, he can drive, but not directly after the first session. So you want to know exactly what will be his response to the first time he's going to take the RTMS, then he can go back and forth without any problem. So pay attention to this. Though it is safe, but you don't know what will be the if reflex or the response of the patient to this type of treatment. You will have the question, how should I prepare? So there is no particular preparation. Just every session will last about 30 to 40 minutes. This can be lengthy, more lengthier than the ECT. And then than this, he doesn't need any other preparation. The side effects, usually it is safe. However, this type of the coil placement, there can be some pain or discomfort, toothache, tingling sensations, lightheadedness. In rare occasions, there can be seizures, impaired hearing if the ear is not protected correctly. So pay attention to this. So yes, it is safe, but in rare occasions, there can be seizures and impaired hearing if the ears are not protected properly. Okay?
Yes, thank you so much.
In termination, you must always terminate. I will give you leaflets about all what we have just said. You are very good. I don't have any comments except that some factual information were missing. Try to add them. Other than this, everything was good. But always bear in mind your communication skills. As I said, the collaborative approach, selling your drugs. Try always to make your information accurate in the explanation station. Thank you so much, Doctor. It was
Thank you
very
so
good.
Thank you so much. Thank you.
Okay, who would like to go next?
I'd like to go next, Doctor.
Well, this is one of the most important sessions actually, because we can see these are new
I can
stations. I
go.
don't know if you can you just raise
Can
your
you
hand or do any.
can you hear me? Can you hear me, Doctor?
Jurai, okay, yeah.
Summer, yes. Summer.
Yes, okay.
Yeah.
Summer or Jurai?
Summer, but this is my account name, sorry. But my name is Summer.
Okay, so you don't want to open the cam. Okay.
I'm sorry.
No problem, but you must be ready to be more confident, okay? I'm worried about the anxiety which is still there up till now. This might not be very helpful. Okay, anyway, what is your station, Dr. Summer?
Generalized anxiety disorder with
Yes.
memory, cognitive changes.
Yeah, okay. I'll put this station on the screen and I will pray. So just take a few minutes to come back.
I can't hear you, doctor. You are
Okay,
mute.
sorry. So yes. My name is Mrs. White, and we will start now. Ready?
Ready.
1, 2, 3, go.
Hello, Mrs. White. I'm Dr. Summer from the Mental Health Unit. So I understand that you have some memory problems recently, and you always have done some investigations, and you want to know the result about that. Is it correct?
Yeah. I'm very worried, doctor. I'm very forgetful lately, and I want to know the results test, and I'm just wondering what's going on with my memory.
I can see that you're really concerned about this problem. So I will share with you the result now. So you have done some brain imaging and blood test and also memory test. And about the blood test and the brain imaging, they were totally normal. And the memory test, you have done it twice. Once 12 months back, and the result was 82 out of 100. And the last one, which was recently, the result was 88 out of 100. And as you can see, there is an improvement here in the score of the memory test. And as I
And
think it
why is
doesn't
that?
fit with the...
Why is that?
Okay. So as I think, it doesn't fit with the diagnosis of dementia as you're concerned about, and it may be because something else. So can I ask you a few questions to make sure what is the problem here?
Yeah, okay, no problem.
So about the problem of memory, when did it start with you?
Well, it started about 2 years ago.
Okay, and anything happened at this time?
Like, not anything happened, but it was the time of my retiring. I was supposed to feel um, more calm, more restful, but I didn't. I feel more anxious. I don't know why.
Okay, I see. I'm really sorry to hear that. And was there any reason behind your retirement? I think it's an early retirement.
Well, no, but this is something which I really felt that could be better for me. That's it.
Okay, and before that, how were you being?
Everything was fine.
Was there any stressors in your life?
Apart from my mother, my mother has Alzheimer, and I always worried about her. Other than this, I don't think that there's any problem with
Yeah,
that.
I understand that your mother passed away. I'm really sorry for that.
Yeah.
Okay, so yeah, so Mrs. White, through these 2 years, was the problem progressing like deteriorating about your memory, or it was like ups and downs?
Well, I cannot tell, doctor, but all what I can feel that there's a problem in my memory. That's it.
Okay, but have you noticed anything exaggerated, like being worried, being stressful,
Yeah,
like
I'm
that?
all I've been all my life, type of a person who gets easily worried,
Mm.
but I don't think that this has anything to do with my memory.
Okay, I see. So, Mrs. White, can I ask you a few more questions? You mentioned that you're always worried. I'd like to ask you what's in your mind when you are worried? What do you think about?
I think about many problems in my life. 1 minute,
Mm,
yeah. Yes. Many problems in my life that
mm,
I'm worried about my pensions, if it is enough for me. I'm worried about my life in
mm,
general. I'm worried about the future. I'm worried that I might develop Alzheimer like my mother who died from Alzheimer.
oh, yeah, this must be so frustrating and concerning. And
Yeah.
how about your feeling? Do you feel you are always on the edge or you are always
Yeah,
startled?
yeah, yeah, yeah. I'm
Mm,
always edge. Everything now is
mm.
just makes me easily worried.
And any
And
body symptoms? Okay, and any body symptoms like feeling heart racing, sweaty?
yeah. Many times I feel that my heart is racing, and for no reason I'm sweating. I feel tense. I have a lot of thoughts in my mind all of the time.
Okay, so I need to ask you a few more questions about your mood. How was it in the last 2 weeks?
Well, I cannot say that my mood is the best, but I am not depressed. I'm not sad. I'm worried most of the time.
Now, about your sleep.
My sleep, I can easily, anything makes me wake up. My sleep is very light. I go to sleep, but it's very light.
Yeah, and are you eating well?
Yes, yes, yes.
And do you have any social stressors like financial or relations?
No.
And do you take any medications on a regular basis?
Only vitamins, that's it.
Okay, and do you use alcohol by any chance?
No.
Any recreational drugs?
No.
Okay, and I'd like to make sure that you are safe here. So do you have any concerns about your safety you want to share with me?
No.
Okay, that's fine. I'd like to ask you about and now I can see there is some I can see there is some link between your
1 minute,
anxiety
1
and
minute
your memory.
remaining.
Okay, I can see now some link between anxiety and your memory problems. As I can see from your test, that the attention was in a very low score, which means when you are very anxious, you can't pay a lot of concentration, and this may affect your memory. Don't you see this?
So why is it not Alzheimer then?
Because it doesn't fit to be like dementia. As I told you, the dementia is a progressive decline in the brain functions. And at this time, there is no evidence you are having a progressive decline. It's fluctuating or even improving, according to the memory test you have done.
I see. Could be there any other reason?
Well, we can consider other reasons, but I can see that the most probably reason here is the anxiety because it affected your attention and your concentration.
Time. How do you feel about it? That's good.
I couldn't do the time management.
ليه
I
يا
couldn't do
بنتي
the
ما why
formulation.
you did it well. You did but always
Thank
put
you.
in your mind that it's normal aging and there is mild cognitive impairment.
Okay.
The memory problems include mild cognitive impairment.
But could it be mild cognitive impairment with this memory test result as it's improving?
Yes, it could be, but in mild cognitive impairment, usually the tests do not improve. Okay.
Yeah, okay.
So this is how we can. We'll see how to do this station. Also, this is one with new stations, and unfortunately, the passing rate in this station is not high. They can just feel it difficult to understand what is expected from them, and how to answer or how to talk about the Edinburgh. The only other point which you should pay attention to that you must analyze the score. So I expected from you to talk about the test results. Are you with me? You hear me?
Yes, I'm here. Yeah, I'm hearing you.
Okay, so we will see how to do the station according to my notes. Yeah, this one. Okay, so pay attention to the following, doctors. As you can see, there is a clear instruction for the role player to behave in a particular attitude. This is something which is not, these instructions are not for nothing. They expect from you to show a communication skill suitable for the attitude of the patient. So she will be so anxious and tense and irritable. You are expected to do like Dr. Summer just to address this and to calm the patient by any means. Just one sentence to address her and one sentence to show that you understand what she is going through and to help her with something like having this conversation with someone who trusts her and so on. Now pay attention, the results of the cognitive tests have improved over 1 year, contrast to what is expected in mild cognitive impairment and normal aging. Mention the possibility of normal aging and cognitive decline and the possibility of mild cognitive impairment at the end of the station. and mention why the cognitive problems are mostly due to anxiety. Okay, the station requires careful time management. As you can see, there are a lot of things you should do. Okay, so in the beginning, try to explain the results. Her CT is okay, no problem in the results of the CT. However, the Edinburgh cognitive test is 88. A score of 88 and above is normal. This is what you should do, doctor. So 88, okay, she doesn't know what is 88. So tell her that score of 88 is and above is considered normal, below 83 is abnormal, and in between 83 and 87 is inconclusive. The results of the cognitive test have improved over 1 year, in contrast to what expected in memory disorders like mild cognitive impairment, normal aging, and dementia. Okay, however, because there is low results and at the same time you are complaining from memory problems, I would like to discuss this with you. خلاص يبقى كده احنا ايه in the beginning we explained everything regarding the results of the tests, which is the first part of the task. Now, taking the history. As we said, taking the history is a stepwise approach, and the most important part is to take the complaint in a systematic, organized way. You want to know the current situation, the onset, the course, and how was she doing before that. Okay, the current situation, you want to know her current condition, when everything started, and the course, is it increasing, is it decreasing, and so on. And before the onset, this is the most important question in the complaint because the candidates mostly forget it, and most of the tricks of the Royal College are in the area of how was he doing or how was the patient doing before the onset, because this is the area of the predisposing and the precipitating factors, which the Royal College usually puts things in this area. Now, the second thing, which the point, I don't know, is it second? The next point, which the candidates feel it difficult to do, is how to ask about the anxiety. As we said before, any psychological phenomenon, if you dissect it into feelings, physical symptoms, thinking, and behavior, most probably you are going to cover it properly in a fully, and I don't think you will miss anything if you just cover the feelings, physical, thinking, and behavior. Okay, so the feelings, do you feel worried most of the time of the day? Do you feel that you are on the edge? Have you ever had the feeling of losing control, feeling that the surroundings are not real, or as if you are in a movie? All these are the feelings associated with anxiety. Now, the physical symptoms are the most important because they reflect the organic part of the anxiety, which is the autonomic hyperarousal. Affects the sleep, palpitations, tremors, dry mouth, abdominal discomfort, and hot flushes. Okay. Those who have anxiety have particular pattern of thinking, like difficulty in concentration and finding them. Most of the time, they are worried by the catastrophic events. They always have this catastrophization of anything. So most of the time they are worried. And they have particular behavior, easily started or agitated. So they can easily, anything put them on the edge and make them jumpy. Very important to ask about comorbidity, which I liked, but the thing which you have missed, doctor, that you should have asked about the other comorbid anxiety disorders, okay, like phobias, okay, panic attacks, any kind of associated anxiety disorder. Show the examiner that you understand that this is the area of anxiety, so there could be other anxiety problems. Okay, and you ask about the mood, psychosis, you forgot. You ask about the medical, you ask about the social, and you ask about the risk. You missed to ask about if there any part or any memory history, any family members who had anxiety, yes, there is memory problems, but any family history of anxiety. And finally, you deliver the diagnosis, which is anxiety, generalized anxiety disorder, and there is mild cognitive impairment or normal aging, but they are excluded because of the memory tests and the results of the brain scanning. I hope that you take screenshots. Okay, thank you so much, Dr. Samar. I hope that you found it helpful. Who would like to go next?
Can I take one, please?
Ma'am?
Yeah.
Excuse me?
Can I take a station?
Who, Dr. V?
Can you say me? Okay, Via. Can
So
you
what
see
is
me
your okay? What is your station? What is the station which you would like to do?
I couldn't choose anyone. I can try
No,
anyone.
no. Please prepare. We don't just.
Okay, I
This
was
is
trying
not
to.
a this
I
is
was
not a
trying to.
mock exam.
I was trying to choose. I was trying to put in my name. I could not do it. I think I was trying to do this homicidal safety plan.
Okay. I will try.
Let me do-
Again, this is one of the stations which the candidates find it difficult because they don't know exactly what to do and how to set a safety plan. Ready?
Okay, let me try. Yeah, it's fine.
Okay. Let's say my name is Mr. Wickets.
Okay. Can I start now?
Yes, go ahead. 1, 2, 3, go.
Okay. Hello, Mr. Wicked. My name is Dr. Isiagboro. I'm one of the psychiatrists here. I've been asked to speak with you today as your GP has some concerns that you've been hearing voices. Yeah, I'm here to talk to you about this and see how best to support. Okay. Can you tell me
just
what's
don't
been
know,
happening?
doctor, Well, I don't know if I can talk about this. I don't know if it is safe or not to talk about it. I don't know.
Yeah. Mr. Wicked, I see it's a difficult one for you to talk about, but I just want to assure you that this is a safe place, and whatsoever you say to me, it will be kept safe, except if there's a risk to you or any other person. Okay, but I'm here to support you.
Yeah, okay. So I have this voice that directly telling me to kill my boss, doctor. So I know this is a stupid thing, but and I don't know what to do. If I just talked about it with anyone, I might get in problems. But this is what's happening.
Thanks for opening up to me, Mr. Wicked. Can you tell me more about this voice telling you to harm your boss?
Well, it's this voice directly telling me to kill my voice, and that's it. And this voice really annoys me, doctor.
I see how difficult is it. For how long have you been hearing these voices?
Well, it all started, we had a quarrel with my boss 3 weeks ago. And since then, I have this voice keeps telling me just to kill him.
And this voice you hear, is it a single voice or?
No, just a single voice just giving me this order to kill him.
So the voice is giving you an order to kill your boss. Apart from this order, what else is the voice telling you?
Nothing. It's just telling me just to kill him. That's it.
Is the voice telling you to harm yourself?
No.
Okay. And did the voice tell you any particular plan, any particular way for you to kill your boss?
Excuse me?
Did the voice give you a particular plan for a way
No,
you should
no,
kill?
just insisting that I must.
Okay. And have you told anybody about this, Mr. Wicked?
No, only you, because if I talked about this with anyone, this can put me in many problems.
Okay. And apart from hearing the voices, are you having any other experience?
No.
Are you seeing things other people don't see?
No.
And do you feel like your actions are being controlled by your boss?
No.
And how has your mood been, Mr. Wicked?
Well, my mood is fine, but as you can see, I'm very frustrated because of this.
Okay. And are you sleeping okay?
Yes.
Are you able to care for yourself these days?
Yeah. I don't have any problem with this.
And are you having any thoughts to harm yourself?
No.
Okay. And do you have any plan to act on the voices you're hearing?
No.
No. Okay. And sometimes when people have this kind of experience, they start using ways, looking for ways to cope. Have you been taking alcohol?
No.
Okay. And you by any chance using illicit drugs?
No.
I see from my notes that you have a diagnosis of schizophrenia and you're on quetiapine. Have you been taking this medication regularly?
Yes.
Okay. And apart from schizophrenia, do you have any other diagnosis?
No.
Do you have any other physical health problem?
No.
Who lives with you, Mr. Wicked?
I'm living alone. My family is in another city.
So if you are living alone, can you have any support? Anyone to support you, friends?
Nowadays, no.
Okay. You've said that your boss, what kind of job do you do?
Well, I'm a porter in this in a facility. That's it. I'm a porter.
And have you been going to work with you hearing these voices?
Excuse me?
Have you still been going to work since hearing these voices?
Yes.
Okay. And while going to work, have you noticed that you have been maybe lashing out at other people at work? And
I didn't get your question again. What did you
since
say?
going to work, have you noticed that you've been lashing out, getting angry at other people at work?
No, I'm not angry. I just have this thought which keeps coming that I must kill my boss, let's say.
Okay. And these thoughts, what do you think about these thoughts that you're having?
Well, I don't know, doctor, what's going on. That's why I came here.
Okay. And is there a possibility that you're having a relapse of your mental health?
I don't know, doctor.
Okay. Mr. Wicked, there are lots of things we could do help support you. Okay, because from what you've told me, it seems you're having a relapse. Okay.
1 minute
Yeah.
remaining.
Yeah. And one of the things we could do for you at this time, you just told me that you're still going to work and you're having these thoughts to harm your boss. I'm quite concerned for you. How about we bring you to the hospital and see how best to support you?
Okay.
Okay. And we'll consider increasing your medication.
But I don't want to go. I don't want to go to the hospital.
Well, we could keep you in the community, and the crisis team would help support you. But because you said you don't have support, and that is why I'm bringing the option for you to come into the hospital.
I see. Okay.
What do you think about that?
It's nice.
Okay. Thank you, Mr. Wicked. Do you have any questions?
No, thank
you. Okay. Thank you. Thank you.
Thank you so much. It's typical what they can just do. They take full history of the event or the thoughts and the risk, and when they come to the part of the management, they talk about the admission of the patient, and he will refuse, and they don't give any other options. So let's have a look of how this type of station can be sorted out. Okay. Pay attention that you don't need to do a full mental state examination because he is already diagnosed with schizophrenia. Okay. And pay attention to the following, that as I always say, there is a challenge for your communication skills. So in this station, the patient will be reluctant to talk about his voices and his problems. Okay. If you are not empathetic, if you are not going, and you can read it in the role player instructions. If you are not empathetic, if you are not robotic and formal, most probably you are going to lose your patient. So do like what the respectable doctor did, and try to be empathetic and try to comfort the patient and make him feel confident that what he's going to say will be always kept secret, and your decision will be always in his side. Okay, so pay attention to this, please. Now, there are two parts of the task, as you can see, that you want to do a risk assessment, and at the same time you want to do a management safety plan. Okay, pay attention to the following. So how can we do this? You introduce yourself. Okay, the patient's going to be a bit reluctant. As we said, you can try to overcome this communication trick. Now, you want to take the biopsychosocial, as we always do, the biopsychosocial part. Here, the psychological, the perception, the auditory voices, which you have just mentioned. Okay, and you want to know exactly when did it start, like what the doctor said, and what is the explanation for these voices. If he has a strong conviction, then this is a patient who should be admitted compulsory. The point that in this station the patient does not have this strong conviction that he should kill his boss. Okay, that's why he can have the chance to be treated outside and he is not totally submissive to these voices. Pay attention to this. So it is very important to ask him what is the explanation for these voices.
Yeah.
Okay. And regarding the persecution, when you ask him, so anyone who wants to hurt you, so he will mention problems at work, but at the same time, there is no particular delusions, just only auditory hallucinations, ordering him to kill his boss, and this is not supported by conviction and supported by perceived delusions. Okay. You ask about the mood, which was very good. Ask about the social, very good. Physical, you ask about. And then it is very important to talk about the risk, because this is the first part of the task. So after understanding the patient's condition, after taking the biopsychosocial background and the level of risk, then biopsychosocial background, then you ask about the risk, which is the first part of the task. Okay. Any plans? Anyone other than the manager? Do you have any plans to hurt anyone else? Do you have weapons? Any previous assaults or police charges? Any thoughts of harming yourself? What do you feel about the idea of hurting the manager? What would prevent you from doing this? So these are questions to assess the risk.
Yeah.
Okay. Again, the plans, anyone other than the manager? All of this, in this, these are the same question. If he has any weapons, any previous assaults or police charges, any thoughts of harming himself. Do you feel that the idea of how does he feel about the idea and what could prevent him from doing this? Okay. Now, it is very important to explain to him what's going on, because from the discussion, it seems that there is a relapse of the symptom of schizophrenia precipitated by the stressors at work. And the relapse is mainly in the form of auditory hallucinations, ordering you to hurt the manager, and the false belief to your manager and colleagues if he mentions the delusions. Now, the formulation, you must formulate, because these are the most important points which you are going to focus on in your management. If we're going through how we can help you, I would like to highlight the most important points which we'll focus on in our management. You have schizophrenia in their labs, consider a risk because of the symptoms, and this is the background of having no physical and good support around you if he mentions that he has his family. Okay. Now, the management. What are you going to do, Dr. Viv, and where the patient is going to be treated? Due to a high risk and safety concern, how do you feel about staying in the hospital until it is safe? Very good that you mentioned this. He will refuse, then you should offer the other options. In this case, I would like to follow you up regularly in near appointments to do thorough risk assessment and address your concerns. Okay, are you following me, doctor?
Yes, sir. I'm with you, Dr.
However, in case of increasing risk, the admission to the hospital will be the best option. Are you okay with that? So the first thing is that you offer the admission, he will refuse. So the other option is the close observation, follow up for risk assessment. And at any time you feel that the risk is high, the admission to the hospital will be recommended. Okay. Always consider the investigations, because there is a possibility that you might change the medications, the doses. Okay, so you need to do some blood tests. Very important to talk about the urine drug screening tests and heart tracing. Very important.
Yeah.
Okay. Now the crisis team will cover all his needs, psychologically, socially, and physically. So regarding the psychological, the backbone of the treatment is to control the delusions and auditory hallucinations and a proper risk management. The medications. Now, it seems that the medications are not enough, so you must consider increasing the dose of quetiapine. If there is no improvement, I'll revise the past medications to choose the proper medications, or we can use clozapine. Okay?
Yeah.
A short course of benzodiazepines is very important to mention. That a short course of benzodiazepines will decrease the agitation and improve the sleep pattern. So this is the first point of the management. You are going to talk about the medications. Definitely you are going to talk about the antipsychotics and the role of benzodiazepines. Talking therapy is definitely will be helpful in this case. Okay, to challenge these auditory hallucination and the orders in order to help him to fortify himself against these thoughts. Now, this is the most important part of, not the most important part, but the missing part in the management, the social. It would be better to take a leave from work. Okay, so the social part of the management is the missing part, which the candidates always miss. So it is better to take a leave. He is going to the work. He goes to the work at the same time he has these thoughts. So it is better for him to take a leave. Would you allow us to contact your work? Very important to contact the work for safety procedures. Very important. Okay, safety percent. The social services will also facilitate the required leave from work, and the occupational services will make sure that the work environment is suitable. So someone who has schizophrenia is not suitable to involve him in quarrels and stress. He will misinterpret them. So the occupational therapist might be helpful in this situation. Again, doctors, the leave, okay, you must contact the work for safety concerns. The social service must be involved. The occupational services also can be involved. Is it okay to have another meeting with one of your family members or someone close to you to be in close contact with you until this critical period is over? Okay. Also, it is important to remove all the weapons around you. I'll give you some contact numbers which you can use in case of emergency. I hope that you all have screenshots of these social points which can be used in the management plan, because this is the part of the management plan which usually the candidates forget. Okay, so this is.
Okay. I have a question, please.
So just
Yes,
can you
you
wait?
said we'll come. Okay.
Okay, please. Okay, so again, back to the management, the crisis team will cover everything. The backbone of the treatment is to control the delusions and the hallucinations and proper risk management. Okay. Always we have this stepwise approach. We talk about the psychological part here, the medications and the talking therapy and the social part of the management, and finally terminate, okay, by giving gifts. Okay, so what is the question though?
I wanted to ask, he has the thought to harm the boss, and you said we should contact the workplace. Are we contacting the workplace to tell them that he's a risk? He has thoughts to
Well,
harm
actually, there is a Sarah Tarasov, you know, the case of Tarasov case.
Yes.
Yes, so so it is a clear Tarasov case.
Yeah.
So when you say that I am going to contact this would give an impression that you understand your work as a psychiatrist who understand how to make the patient safe and everyone
keep others safe.
Okay,
Yeah.
so
thank you.
Okay, so but what is the other question? Someone had a question. Okay, so rapidly take screenshots. This is one of the news stations, and unfortunately,
in that case, doctor, we have to break confidentiality or not?
Again, what did you say?
In this case, we have to break confidentiality or not?
The confidentiality, as I said, has limits. The Sarah Tarasov case is a clear case of the confidentiality limits. There is another person who is a potential, can be a potential victim. Okay, so you must say that we are going to contact the work in order to help them understand the situation of this patient. Okay. And I don't think that anyone who will not say this point that you are going to contact the workplace will pass this stage, because it's typically the Sarah Tarasov case, exactly like the Sarah Tarasov. Was it Sarah? It's called Tarasov, not Sarah.
Doctor, if he said I'm going to take a sick leave, so in this case we don't have to call the ward?
No, I guess in my opinion, because sick leave will not change the thoughts. It will just make him will not go to the place, but it will not change the thoughts. Just take screenshots, please. Okay. Okay, thank you. Who would like to go next? And by the way, no, something which I would like to add here also. In the exam, you are always a trainee. You are always a trainee in the exam. You are whatever your medical experience is. So it will be very good in this station to mention that I would like to discuss this with the consultant. Okay, I would like to discuss this, your case. So I'm very okay. Let's see what are the questions. Yara.
Yes.
Yeah. Assalamu alaikum, Dr. So what is your station?
Alaikum salam. My station is DBT.
Yes, again, this is one of the new stations, and the candidates feel it difficult.
Yes, it's very difficult.
Okay, let's see. Okay, ready?
Okay. What will be your name?
Let's say that my name is Michelle.
Okay. Okay.
Okay, so you don't want to open your cam also, doctor?
I can open it, but my child may come and I will close it. Okay, no problem.
No problem.
Okay. Okay.
Okay, doctor. So very good. So we will start now.
Okay.
1, 2, 3, go.
Hello, Mrs. Michelle. My name is Dr. Yara Ihab. I am one of the mental health team doctors here. I understand that you want to talk to one of the team about DBT. Am I right?
Yes, I want to know more about this type of talking therapy, if you don't mind.
Yes, I'm really glad that you came here today. But first of all, may I ask you some questions before we start talking about DBT, please?
Yes, okay.
Okay. Is it okay to tell me who recommended you this kind of talking therapy, DBT?
My consultant said that I must take a DBT, but he did not elaborate much about it. That's why I booked an appointment with you.
Oh, okay. So DBT is recommended for some clients that complains from some symptoms. So I want to ask you if you have any of them. Is it okay with you?
Okay, no problem.
Okay. Do you have any suicidal behaviors or self-harming behaviors?
No, I don't have these days. No, I stopped doing anything stupid.
I see. And do you have a feel like you are intensely angry or frustrated?
Sometimes, yes, sometimes.
Mm-hmm. And what about taking some street drugs? Did
No,
you
I
try
don't.
to do this
I,
before?
I don't do drugs.
Okay. If I told you to describe for me your relationships, what will you tell me about it?
What?
If I asked you to describe for me your relationships, what you
Well,
would tell
I
me
don't
about
have
this?
my relationships are ups and downs. No, I never had a stable relationship.
Mm, I see, I see. Okay, as I understand from what you told me now that you were diagnosed with emotionally unstable personality disorder, and this diagnosis is suitable for treating with DBT talking therapy. Am I
Okay,
clear?
okay,
Okay, but actually, this type of therapy goes well with some clients and doesn't go well with others. So, if you have some difficulty expressing or recognizing your emotions, or you have some suppressing your feelings to avoid vulnerability or avoid being vulnerable, does this happen with you?
no.
Okay, that's really good to know because these things are the contraindications for DBT therapy for this kind of client. So if you don't
Okay,
have this, then you are suitable for it. So let me go back to your question about what is DBT.
okay.
Okay, DBT is this abbreviation for dialectical behavioral therapy, and it's a very effective talking therapy to help clients who are diagnosed with EUPD, emotionally unstable personality disorder, as I told you before.
Yeah,
Are you with me?
yes, okay.
This kind of talking therapy helps the clients to control their emotions and to improve their stress tolerance and anger feeling.
And so, but how does it work, doctor?
Actually, it works with in sessions with a weekly session. Each session is 40 to 60 minutes with a therapist, a specialized therapist in the DBT therapy.
I see, I
Am
see.
I clear?
Yeah,
And DBT uses different approaches. There are specific approaches that DBT uses. One of them called mindfulness. Did you hear about this before?
now what is mindfulness?
Actually, mindfulness it means that the therapist teaches the client to concentrate on only to focus on the present moment without labeling anything or judging anything around it.
I see.
Are you following me?
Yeah,
Okay. And actually, this is one of the skills that will be taught in DBT sessions.
I see.
The other one is distress tolerance. Distress tolerance, it means that the therapist, can teach the client to how to overcome stress and how to deal with it.
I
Are
see.
you with me? Mhm. And another two things about DBT is emotional regulation and interpersonal effectiveness. Emotional regulations because there are some problems in emotions that the client cannot handle them. So this will be taught in the sessions how to regulate their emotions. Are you following me?
Yes, yes, yes.
Mhm. So
Very
I hope that I could answer your question about what is DBT. Do you want to know anything more about this?
no, but I'm just wondering how long would it take, doctor?
Actually, each step of the four steps that I told you about, each will take around 6 weeks to be done, and in each week you will have one session. And I wanted to tell you that DBT has group therapy also, not only individual, that you will be with your therapist. This is called individual therapy. And the other part is group therapy. You will be with people with the same diagnosis as you are. And the benefit of this group therapy is that you will learn with each other the skills, how to do it in the real life. And
I
this
see.
is
So
very, very effective.
what will happen in case of emergency?
This is an very important question to ask about. In the cases of emergency, DBT help individual to manage the intense emotions, as I told you, and the therapist will help you to learn about the crisis plans
I
and the
see.
skills to pass distressing moments, like intense exercises, paced breathing. Are you following me?
Yes, yes,
Mhm.
yes. Okay, time. How do you feel about
بجد
that?
سمعت. I don't know. I don't know
Well,
this station. I
you
didn't.
had lot of accurate information, but the point is that, as I always said, you must be confident. You must be. I felt that you're a bit hesitate. You don't have the self-confidence. Just try to be confident while you're offering this type of treatment. Um, as I said, this is one of the difficult stations because most of the candidates usually forgot what is the dialectic behavioral therapy. So take some screenshots. I don't think that you'll find it anywhere else. Okay, so first of all, as you can see, there is the task is to check the suitability for DBT and explain the DBT. So the first thing is that you want to know whether she is suitable for the DBT. Okay, so the first thing is that you will introduce yourself. You are going to, is it okay to share with me why you have been recommended the DBT? And DBT is suitable for clients who have particular complaints, which I would like to check. Suicidal, okay, these symptoms of those who have borderline personality, as you all know. But there, on the other hand, there is a specific group that seem not to benefit from this type of treatment, like those who suffer from maladaptive overcontrol, like a type of coping with emotional pain that leads to social isolation, being aloof and distant relationships, a risk of aversion, and strong needs. So these types of patients or these types of symptoms, if they are present, usually they are not going to make the patient find benefit from this type of treatment. Also, there is inhibited emotional expression and hyperperfectionism. All these are symptoms which the patient, if they are having, usually they are not suitable for this type of therapy. So this is the first part of the task. Who is suitable for this type of talking therapy? I would like to start discussing the DBT from what you already know. Show what is she doesn't know anything. So sell your drug. What is DBT? It is a talking therapy diagnosed to have the patients who have emotionally unstable personality disorder and try to, yes, it is written here DBT, but when you are talking, don't say DBT, say dialectic behavioral therapy. Emotional unstable personality disorder. Don't say BDP.
UPD.
Don't. Okay. BPD. Okay. Just try to talk without using these acronyms. How does it work? Now, the DBT uses different approaches to help the clients. First of them is the mindfulness. Okay. And there is individual personal therapy, group therapy, and coaching on demand. So there are things which the patient is going to do by himself, and there is ways by which the patient is going to get support from others, like the individual patient psychotherapy, group psychotherapy, and coaching on demand. How long does it take? Okay, the duration of treatment differs from one client to the other. However, a full course usually takes around 6 months. Okay, so this is different from the usual CBT, 6 months. There are 4 modules of dialectic behavioral therapy: mindfulness, distress tolerance, emotional regulation, and interpersonal effectiveness. Usually, the patient spends 6 weeks in each module. Okay, so there are phases of for this type of therapy, as we said. Each phase, the patients then spend 6 weeks in them. Everyone okay so far? Take screenshots, please. So there is particular structure for this type of therapy. Stage 1, okay, there is commitment, safety, and stability stage. It targets the life-threatening behaviors, self-harming behaviors, and severe quality of life-threatening behaviors. So there is a structure, as I said. The first thing, okay. So the first stage is that the patient is you are going to address the most important or most life-threatening things. It is commitment, safety, stability. It targets the life-threatening behaviors, self-harming behaviors, and severe quality of life interfering behaviors. The stage 2, in this stage, this is a stage in which the symptoms, you try to reduce them. It targets the eating, the mood problems, and the trauma. The stage 3, which you have mentioned, doctor, which is the regulation of emotion, the REACH, which you have the acronym of REACH, the regulation of emotions, the acceptance and change, and etc. All these are in stage 3. Okay, are you with me, doctors? When
Yes.
you say these things, you will give an impression that you understand the DBT, and you will pass, because those who know what is the DBT, what is the structure of the DBT, how it works, those are the candidates who will pass. And unfortunately, most of the candidates don't understand quite well what is DBT. Okay? What will happen in the emergency? Okay, so in the emergency, there is crisis survival skills, which is part of the component of the DBT, can help the patient to manage these crises or these difficult moments by distraction, self-soothing, etc. You will find them. The skills can be practiced and improved over time, leading to increased emotional regulation, etc. Also, the clients will know how to use helpful skills to pass the distressing moments. These skills has the acronym of TIP. Okay, TIP. You mentioned these things will give a very good, okay, temperature change, intense exercise, paced breathing, and paired muscle relaxation. So these are the things which the patient is going to use if there is some sort of emergency. Pay attention that these are the questions which you are going to have from the role player, okay? What will happen in the emergency? Okay. Am I going to talk in front of a group? The purpose of group DBT is to learn new skills and to work on utilizing tools you have been taught. Okay, so yes, there is part of the treatment with a group. Many of the clients see one or four of our therapists individually, but don't participate in the group. So being in a group is an important part, but it can be postponed. Why it will work while other therapists have not? Why is that? Because recommended mode of therapy according to the guidelines for the emotionally unstable personality disorders, because it covers the needs of these types of patients. Take screenshots, please. This is one of the stations which have horrible passing rate.
May I ask you a question, Dr. Hussam, please?
Yes.
So in the explanation of the DBT, when the patient asks me what is DBT, I will tell him the modules of the DBT or the steps of the DBT about the mindfulness and the individual, group, and coaching. Which one I will answer him with?
Okay, just take screenshots and we will do according to the notes. So, okay. Oh, so this is your question. DBT is very effective talking therapy. You are going to sell your drug and then go to the explanation. Okay. So this is how you answer the question.
So the answer will be the mindfulness, individual, group, and coaching, not the 4 modules of the DBT. Am I right?
Yes. What is DBT? The question is here and this is the answer. The question is here. What is DBT? And this is the answer. Okay, so far you have this introduction and then you are going to go through the details. How does it work? Different approaches, mindfulness, individual personal therapy, group psychotherapy, and coaching on demand.
Okay.
And there is a particular structure. As we said, there is particular structure in this type of psychotherapy. There are particular stages, stage 1 and 2 and 3. We don't start by regulation of emotions and before stage 1. Okay, there is hierarchy of the importance of the symptoms. We start with the most important symptoms which we need to control, and then we go to the rest. A very important, what will happen in the emergency, please read it again. I'm not going to go through it. Okay, that's it. So regarding this type of stations, who would like to go next? I hope that you found it helpful. Read these stations and good luck. Who would like to go next?
I can go next, doctor. The care needs.
Okay. So, okay.
Okay, doctor, I can go.
Okay. Again, this is one of the new stations with low pulsing rate.
Okay.
And when I say go, 1, 2, 3, go.
Hello, Mr. White. I'm Dr. Summer from the Mental Health Unit.
Hello, doctor.
Hello. I understand that you want to go home, and I'm here to talk to you about that. Is it okay?
Yeah, doctor. So is there any problem going back home?
I will talk to you about that, but first I'd like to ask you a few more questions. Is it okay?
Yeah, no problem.
Okay. Can you tell me more about the circumstances for your admission to the hospital?
Well, because of them, they are very annoying. Well, if you have an annoying wife and annoying family, definitely this will escalate the problem.
Yeah, I understand what you mean, but I need to understand more about what happened. I understand you have been violent with them. Is it right?
Yeah, and they are the reason for this. Yes, it happened. Some violence happened, and but they are the one to be blamed.
Okay, I can see. And was you under the effect of anything when this happened? Alcohol, any drugs?
No, no, I don't drink alcohol. I don't do anything.
And you mentioned they are annoying you. Is there any specific reason for that?
Well, you can ask them.
Okay, I can see. I can see you are not really happy for this talking, Mr. White, but it will be very brief. Okay, and I'd like to ask, is it the first time to be violent with someone?
Well, it's almost because we have some family disputes. I'm a peaceful man, but in the family there are
Mm,
some problems which they
I
are to be
see.
blamed for.
Okay, I see. So how do you feel regarding this at this time? Do you think you can do this again?
Well, this depends on them, not me.
Mm-hmm. Okay, so I need to ask you a few more questions if you don't mind. Do you have any physical symptoms?
No.
Do you take any medications?
Well, I take some medications like mirtazapine and trazodone. I have some depression and sleep problems, but nothing more.
Okay, I see. And I understand that you have, when you come here, you had some symptoms of depression. Your mood and your sleep wasn't so okay. So how are you now? How is your mood
I'm totally fine.
and your sleep?
Everything is okay.
And whenever you are stressed, do you have any unusual experiences like hearing voices?
No, I'm not crazy.
No one is suggesting that. So do you think anyone wants to harm you or after you?
No one wants to harm me, but there are some family disputes between me and my children. They don't understand me, and it's their mistake.
Yeah, I can see that you have some social stresses here. Do you have any problems with your work? I assume you are working.
No.
Any problems with the police?
No.
Any financial problems?
No.
I'm just trying to make sure you're safe. So, have you ever had any thoughts about harming yourself?
No.
Okay,
But I
and
want to go back home, doctor. So I think this is it okay to go back home?
is it okay? Of course, we will talk about that in a minute. I just want to make sure that you will be safe at home. So, can you tell me, Mr. White, about difficulties you can have in home, like doing your activities, taking care of yourself?
I don't have any
About,
problem.
mm, have you ever get any falls in the house?
Well, the problem is that my family are not helpful. That's it.
Okay, I see. And about your memory, is there any problems with your memory?
Well, sometimes they say that I'm forgetful, but I don't think that I'm forgetful.
Okay, I see. And any problems with dealing with financial issues every day?
No.
Any accent habit at home because of being forgetful, like forgetting the gas or so?
No.
Okay, and do you use alcohol, Mr. White?
Well, sometimes I drink like anyone else, but I don't have any problem with that.
Okay, and about recreational drugs, do you use it any recreational drugs by any chance?
No.
Okay, thank you, Mr. White, for this information. So I understand that you had some depression symptoms and you have been improved by the medication right now. And I understand that you want to go home, but I'm really sorry to be the one telling you that there is some legal order against you raised by your wife and your son, and you will not be able to go home.
So where should I go now? I won't be living like this all my life.
Of course, it's not the case, Mr. White. We are going to help you and support you through this. But at first, I'd like to highlight the most important points we have discussed for today. So, as I think you have some depressive disorder and you have also some false fixed beliefs, you have some risk towards yourself and towards others. You can't go home. Okay, you can't go home for today, and we will express this in a minute on the background of having no physical disorders and very low social support. Now, I'd like to talk to you about the management plan. At first, I'd like to talk to you, where are you going to be? There is some options we have here. You can be in an independent property, and there will be carers, which will help you every day. What about that?
Okay.
That's okay with you?
Okay.
Okay, so I will need to see you in the clinic to make sure you are improving about the depressive symptoms and to do some memory test. And we will do some rechecking about the investigations like CBC, kidney function test, and liver function test. Are you following?
Yes.
And of course, we will refer you to physician if there is any problems with these tests. We are working in a multidisciplinary team which will cover all of your needs. And also, we will offer you some talking survey for your depression, if it's okay with you. And about the alcohol problem, we can offer you a visit to the alcohol misuse service to make sure that
how do you feel about what you did?
I don't know, have I lost any time in
No,
anything?
no,
I'm
no.
always late for the
Actually, it is a
management.
challenging station, actually. But I wish that you started the management by talking about the social part and then continue with the other parts because, yes, what are you going to do? And then go to the most important part, which is as you said, there will be a team, but start with the social part. Okay,
I
so
thought it's important for the patient, and I was afraid of the time, so I wanted just to make him reassured about there is a place for him. Uh,
yes, yes,
yeah.
yes. Very good that you mentioned
Is it
it, but
right?
you could have elaborated more about this.
Yeah,
Okay, so
because
let's see according to my notes. Okay, so this is the dental care needs management. Okay, very good that in the beginning, as we said, you will always have a patient or a situation which will challenge your communication skills. So this will be a defensive man who denies that he is taking alcohol, denies that there is any mistake from his part. Okay, you should try to accommodate him and reassure him that you are on his side. And then after that, take the biopsychosocial to understand what has been going on, which you did. I hope that you take screenshots. I don't want to go to reading the papers, it will be a waste of time. Okay? You take the biopsychosocial, which you did, and then very important to assess thoroughly the level of risk, which you did also. Okay? And then you start to explain to him what's going on regarding the depressive episode and the false fixed belief behind what happened to his wife, and then let him understand the injunction order, and then so take the screenshot, and then do your formulation. Okay, and finally, as we said, when you talk about the management, usually we only have no more than maybe 70, maximum 90 seconds. What are you going to do, doctor? Summer and where the patient is going to be treated. So you want to follow him up more regularly for his depressive symptoms and the memory problems. And you want to make sure that his needs are met and to do thorough risk assessment and to address his concerns. So this is where he's going to be treated. He's going to be treated in the OPD. Investigations, as we said, then there will be a team. As we always should mention the team because the team reflects that you understand that your approach to the patient is comprehensive. It's not just medications. There will be a team which will cover all your needs psychologically, socially, and physically. But here, the sequence could have been better. I know that I write physical, psychological, but it would be better to start with the social part because already the man is psychologically stable. He does not have any physical problems. So the social part will be the best part to be starting with regarding what will the team do because you need to make sure that there is an accommodation for him and also the financial matters will be met. So have a screenshot regarding this social part of management. Okay. I would like to know where would you like to stay, bearing in mind the needs and the difficulty to live independently. Okay. And give him the possibility, one possibility that would be going to an independent property with carers coming to support you. You can also have carers coming into a sheltered or supported accommodation, or he can go to a residential home. Okay, and you can give one or two sentences under the what is supported accommodation and what is the residential home. So these are the three options for this man. And regarding the financial matters, you can ask him about the lasting power of attorney for financial matters, which would allow someone else, like a solicitor or family members, to make decisions about his finances. Okay, so this is the
Sir, I
social.
have a question.
No, yes.
I have a question, please. Since this man he doesn't have insight about his wife, she's not faithful and he is still in risk, he will harm her. Shouldn't we stay him in the hospital for a while? He's
No, he is
risky.
the task is that he is about to be discharged.
Even I found
Hear
all of
me,
this in the
doctor,
station.
please, you must understand the situation and the task. So we're
Okay.
not going to go through philosophical discussions. The task is to
Okay.
explore his care needs and a management plan for his discharge. So the question of him being in the hospital is already answered. No, he's going to be discharged, and you are supposed to sit with him to understand his condition, his needs, and accordingly formulate a management plan for the discharge. Okay. You can argue a lot of time about the condition of this patient, whether he needs to be in the hospital, continue, discharge, not discharge. But here in the station, you are supposed to formulate a discharge plan for him. So no need, don't waste your time with these arguments. Okay, he is supposed to be. You are here to discharge him. Okay.
Okay, and even we don't need to talk about antipsychotics or so because
No,
he showed
talk
some.
about this, but I said it is better to start with the social part because, as I said, this man already
Okay,
on medication. His problem is the discharge. What will happen? He goes back home. Okay. Did you
okay,
take screenshots?
yeah.
All took screenshots. Okay. Thank you so much. Who would like to go next? I think we have finished.
If there's any other one I can take if nobody wants to do a station.
What station are you going to do?
I can't access the anyone, please. I can't access the notes right now.
So what do you want? So what station are you going to do?
Which one is there, Dr. Sam? Anyone I can do it. I will try it.
Okay, just for the sake of that you can have access to the station, because I know that this can be the last time we can have this. Usually I don't just the candidates should prepare, but in this situation it is an exception because this is the last
Thank
time.
you. Okay.
Okay, so this is the capacity explanation and management.
Let's see. The police command. Just an injection. Take place. They put on the stuff. 18. Communicate. Thanks, you might die.
Ready?
Okay. Yeah, that's
Okay. Let's say that my name is Michael.
yeah.
1, 2, 3, go.
Okay. Hello, my name is Dr. Isiagboro. I'm one of the psychiatrists here. How
Hello.
would you like me to call you, please?
You can call me Michael.
Oh, hello, Michael. It's a pleasure meeting you today. Yeah, I understand you are here to talk about Mr. X.
Yeah, Robin. I don't know. I guess I've been told that you did something called capacity. What's going on?
Yes. Yeah, we did an assessment on Ruben, and I'm happy to explain to you what our findings were. But before I talk about this, I want to get to understand, what do you know about what's happening to Ruben?
Well, we know that he has schizophrenia, and he is in a shelter, and he has also mild learning disability. He's on Risperdal medications, but sometimes he does not take them.
Okay. All right. Yeah, so yeah, you are right. I can also see from the note that he's on risperidone. Okay. Also he has been bleeding for some time now, and there's a plan for him to have a camera test, okay, to know the source of the bleeding. But at this time, Ruben does not want to do this test.
Yes.
Yeah. Okay. Are you aware of this?
Well, I know, but I've been told that you did something called capacity. So
Yes.
why did you do for him this capacity?
Okay. Usually, a capacity assessment is done to check if people have the ability to make decisions. Okay, because Ruben at this time is refusing to do the camera test at this time, and that was why a capacity assessment was done for him.
Okay, so well, how do you do this type of capacity?
Thank you for that question, Michael. So in a capacity assessment, okay, it involves four components, where we check the ability of a patient to understand an information, and also check if they're able to retain, and if they're able to weigh the pros and the cons, and if they're able to communicate the decision. Are you with me so far, Michael?
Yeah. Well, I've heard the term something said that we're going to take something called best interest meeting. So, what will happen in this meeting?
Okay, all right. So usually best interest meeting is done for people we think do not have the ability to make a decision. And at this time we think Ruben does not have the ability to make a decision because he's not able to weigh the pros and the cons. And so we think a best interest meeting will work for him at this time. Okay.
Okay, shouldn't his mother take a decision in this condition?
I see where you're coming from, but however, in this kind of situation, he has to make the decision himself, and since he's not able to make it, it should usually be done by a team, those
I
involved in
see.
his care. Yeah,
I
it's
see.
not something somebody can make the decision except the person has a lasting power of attorney. Can I check if the mother has a lasting power of attorney?
Well, you can check. I don't know anything about this.
Okay.
So,
Okay, I will confirm that.
okay. So I'm wondering, so is it legal to go against his wish?
Um, yes, within the Mental Act, we can do that because he's not able to make decision at this time, and I would think his learning disability and all his paranoid thoughts that he's having is interfering in him making a decision that he would have made if he was well. So we can't go against his wish at this time for his best interest.
Okay. Well, can I give a consent for this on his behalf?
Yeah, I see how you care for him, Mr. Michael, but I'm afraid you won't be able to make a decision on his behalf. This will be a joint decision by the team.
I see. So, well, how are you going to help him then?
Yeah. So what we'll do now is we have to arrange a meeting as soon as possible, like an emergency, because he is bleeding, and if we don't manage the situation on time, he might keep bleeding, and that could be fatal. So at this time, we'll have to arrange for the meeting, and then we'll keep managing him. I'm sure the medical team we do things to will be on top of the situation, like give him fluid, just to do things that will keep him stable for now.
I see. I see.
Yes. Does that answer your question,
Yes.
Michael? Yes. Okay. And would you want me to tell you more about what could be what we think is holding him back from making decisions?
Yeah, it would be helpful, yes.
Okay, yeah, because like I said, he's not able to we don't think he has capacity at this time because he's able to understand, he's able to retain, he's able to communicate, but as far as the weighing the pros and the cons, he's thinking the police are out to get him, he's thinking the camera test is for police to monitor him, he's also thinking the doctors and the nurses they are conniving against him, and that is affecting him from making a decision. And that is why we say we don't think he can weigh the pros and the cons. And that's why we think a best interest will be helpful at this time.
Okay.
Okay. Thank you, Ruben. Do you have any other concerns?
No.
Okay, thank you so much. I could give you a leaflet to read more about what the best interest mean and also what it means to assess a capacity of a patient. You can read more, and if you have any questions, I will let you know. I could happily answer the questions.
How do you feel about what we did?
Doctor, I don't know, Dr. Brian.
All these stations are new stations, and the passing rate is not good. So I will show you the notes, take your screenshots.
Okay.
And good luck.
Thank you.
Okay. So the station here has a lot of points to be covered in the task. You have done capacity assessment with a medical ward, and now you are going to speak to the support worker to explain the findings. You must address the concerns and devise a management plan. Okay. So this is a management task. We're going to go with the our stepwise approach: introduction, gathering the biopsychosocial and risk, explanation, formulation, and management. So gathering the biopsychosocial, which you did, you want to know more about his condition, his physical needs, psychological, what is it. So you start by gathering, you want to understand more about the patient's background, okay? And then the explanation, which is simply the answering of the role players' questions. Take the screenshots, please. Do you think that he has capacity to refuse the treatment? You are going to answer simply that he doesn't have the capacity for the reasons which you found. I'm not going to read in the the component of the answer. So how do you make this assessment? As you said, the understanding, the weighing, etc. What do you mean by the best interest? This is an important question. Decisions for adults who lack the capacity consent to medical treatment are governed by the Mental Capacity Act. Mental Capacity Act, sorry. Okay, which specifies, etc. Okay. Okay. Should his mother, so this is the best interest. I'm not going to go through the details, just take screenshots. You will know the answer. Shouldn't his mother take the best decision? As we said, mental capacity. You did not mention the Mental Capacity Act, Dr. Once.
Yes, yes.
Once, I expected from once you didn't.
Okay. I said Mental Health Act instead of Capacity Act.
Okay. No, Mental Health Act is different from
it's different. Yes, that was a mistake. Yeah.
Against his wishes, yes, according to the Mental Capacity Act. You must formulate according to what you have already known from the patient's condition, from the information you have gathered from this man. You are going to formulate. By this time, you should all know how to formulate. Now the management, which is the difficult part of the station. Now, in the management, we are going to go in the same stepwise approach of our talking about the management. What Dr. Viv is going to do and where the patient is going to be treated. So you want to, again, to talk to your patient to explain the final decision and the reason behind it, and to address all his concerns and to reassure him that all his worries are not real. It will be helpful to use visual materials and to have someone whom he trusts during this situation. Okay, doctor? Pay attention to the management, which I don't think that you have approached it very much.
Okay.
I will also explain to him that he needs to stay in the medical ward until his medical condition is during which he will be escorted with a stable. Condition is stable, sorry. Is stable. So he will stay in the hospital with a nurse. If he refuses, we might consider the use of Mental Health Act. Okay. I would like to contact his treatment team to understand more about his mental condition and to update them with the medical condition and the capacity assessment. So this is what you are going to do, Dr. Viv. Pay attention.
Yes.
Okay. Are you following me? I don't think that it is difficult.
I'm following you here. I'm listening.
Everything is easy, but just to highlight and bring the points between each other. Okay. Regarding the investigations, as we said, the next point after what are you going to do and where the patient is going to be treated, the point of investigations here, you are going to encourage him to do the investigations. Okay. So there is a medical team who wants to do for him the investigations, and your role is to encourage him to do the investigations. Finally, there will be a team which will cover all his needs physically, psychologically, and socially. Physically, the medical team will take the best interest decision and will determine the required medical intervention and the medications, etc. Okay? Psychologically, now very important to put in your mind that this patient can be tense, so you can use benzodiazepines if he is not controlled. Okay? Also, Mr. X's mental state should be thoroughly assessed to determine the need for changing the dose of risperidone or changing the medication. So this man is totally deluded, so there is a big possibility that he can be agitated. So there is a place for the benzodiazepines, and also because of his abnormal mental state, you might consider changing either the dose of the medication or the total medication. You can use another medication. Socially, we can contact the mother or someone who believes, whom he trusts to be beside him. So there will be a team, as we said, which will cover physical, psychological, and the social needs of the patient. Under each point, the physical, you are going to put some points to cover them, the physical, psychological, and social, as we have mentioned. I hope that you take screenshots. And finally, terminate, okay? By giving me, I will give you my contact number, okay? So this is how you would best terminate this station. So you understand now the management, doctor?
Yes, I do.
Okay. So the management start by what we are going to do and where the patient is going to be treated. Then talk about the investigations which you are going to motivate the patient and encourage him to do. And then the team which will cover all his physical and psychological needs. And we explained how the patient, how the team is going to do this, and finally terminate. So this is your management plan. And definitely, if you said it, you will be different from the candidates, because most of them, I don't think they mention any of these things, and they don't pass, and the passing rate of this station is not high. Take screenshots and good luck.
Thank you. Thank you so much. Thank you.
Okay, so I think we have finished. Thank you so much,
Thank
doctor.
you. Bye. Thank you.
Doctors, I wish to see all your names in the pass list. You should be totally dedicated to the exam from now on. Not less than 10 stations every day to revise, and this is not a difficult target to achieve. Have good luck, doctors.
Thank you, doctors.
Thank you.
Thank you so
Dr.
much.